In this segment, we're going to talk about a very important value, which is the ejection fraction. Very important to understand this concept. So we already talked about the factors that increase the stroke volume and the cardiac output, and the factors that decrease the stroke volume and the cardiac output. Now let's do more definitions. So at the end of diastole, this end diastolic volume of blood accumulates in the left ventricle. If we give a number for that, let me say 135 milliliters of blood. So the end diastolic volume of the left ventricle is 135 milliliters of blood. And when the left ventricle contracts, it ejects 70 milliliters. Each time it contracts under usual normal circumstances. So a normal left ventricle pumping normally without stimulation, without anything, it ejects 70, which means when the ventricle contracts, it does not empty completely. So not all the 135 mL get out of the ventricle, but some blood remains in the ventricle after contraction. And this is the end systolic volume, ESV. So the ESV is roughly 65 milliliters. And the stroke volume is simply the difference between the end diastolic and the end systolic. So let's look at the effect of the three determinants of the stroke volume. When you increase the preload, then the end diastolic volume goes up, and as a result of that, the stroke volume goes up. When you increase the afterload, the stroke volume goes down because you're making it more difficult for the heart. When I increase the difficulty of the test, the grades go down. And when the stroke volume goes down, more blood remains in the heart. So the end systolic volume increases. When you increase contractility, a fancy term for contractility is inotropy or inotropy. So when we say positive inotropic factor means any factor that increases the contractility of the heart. Negative inotropic factor is any factor that decreases the contractility of the heart. So when you increase inotropy, when you increase the contractility as in exercise, the stroke volume gets higher, and consequently the end systolic volume gets lower. It's kind of a triple relation between these three values, end diastolic, end systolic, and stroke volume. So let's now talk about this important, the definition of this very important ejection fraction thing. The ejection fraction refers to the percentage of blood that is pumped out of a filled ventricle with each beat. Let me use the white board to explain this. Let's say it's Black Friday and you are going shopping. And let's say you fill your purse with $100. Okay. And you return home with $20 left, which means you spent how much? You spent $80. okay? So what's your spending fraction? If I want to calculate your spending or shopping fraction, will be what? How much you spent in relation to how much you had, right? So you had 100. Out of this 100, you spent 80. So your shopping fraction or spending fraction is 80%, right? When we apply this to the heart and we talk ejection fraction, it's how much volume you eject, or the ventricle ejects when it is full. So the ejection fraction, like you fill your purse with $100, you fill your ventricle with the end diastolic volume. You spent $80 and the ventricle ejects the stroke volume. So that's the ejection fraction. Sorry, this is an F, not a V fraction. So that's the ejection fraction. It's the stroke volume, which is about 70, divided by the end diastolic volume, which is about 135, and the ejection fraction is 52%. 52%. So the ejection fraction is all about how much you eject in relation to what you started with. How much you eject in relation to what you started with. So the ejection fraction measures the efficacy of ejection. And the ejection is related to the contractility. If you contract more, you eject more. That's the systolic function of the ventricle. In systole, the ventricle contracts and ejects, contracts and ejects, contracts and eject. If you contract more, you're going to eject more. If you contract less, you're going to eject less. So the ejection fraction is an estimate of cardiac contractility. So the ejection fraction is an estimate of contractility, and contractility occurs in systole. So it's an estimate of the systolic function. So low ejection fraction means systolic dysfunction. What about diastolic dysfunction? Is the ejection fraction an estimate for the diastolic dysfunction? The answer is no. Simple no. The ejection fraction can be normal and the patient has diastolic dysfunction. So the ejection fraction is only an estimate of the systolic function, contractility of the heart, which means low ejection fraction means systolic dysfunction, which means what? Heart failure with systolic dysfunction. And we can also call it heart failure with reduced ejection fraction. So low ejection fraction means heart failure with reduced ejection fraction. And usually here we need an ejection fraction less than 40%. To qualify as heart failure with reduced ejection fraction, we need to have an ejection fraction less than 40%. If we have normal ejection fraction, and the patient has signs and symptoms of heart failure. Can this happen? Yes. Because normal ejection fraction means what? Normal systolic function. And we know that there are two types of heart failure. Heart failure with systolic dysfunction and heart failure with diastolic dysfunction. So with a normal ejection fraction, we know that the systolic function is okay, but we don't know about the diastolic function. So if this patient has signs and symptoms of heart failure, so for sure, it is the diastolic function that results in a low cardiac output. So if you have signs and symptoms, clinical picture of heart failure with a normal ejection fraction, this does not exclude heart failure, because heart failure, after all, is a clinical diagnosis. But what type of heart failure is that? It's heart failure. So these two together means heart failure with diastolic dysfunction. And because nothing should be normal in a patient with heart failure, we don't say it's heart failure with normal ejection fraction. We describe it as heart failure with preserved ejection fraction. Preserved means above 50%, because the normal ejection fraction is 52 or above. So these are the two types of heart failure and their relation to the ejection fraction. Let me get back to the PowerPoint and just put these definitions, see these definitions in the PowerPoint slide. So the ejection fraction refers to the percentage of blood that's pumped out of a filled ventricle with each heartbeat. It's somewhere between 50 to 60%. So remind you of the definition of the end diastolic volume. It's the volume of blood in each ventricle at the end of diastole. It's a surrogate of the preload, venous return, ventricular filling, and ventricular filling pressure. The end systolic volume is the volume of blood in each ventricle at the end of systole, and the stroke volume is the difference between the two values. And the ejection fraction is nothing but the stroke volume divided by the end diastolic, and you multiply it by 100 to get it as a percentage. Ejection fraction is a volume measurement. Yes, it reflects the ventricular systolic function. It reflects the efficacy of the contractility. Low ejection fraction means systolic dysfunction. And systolic dysfunction means low cardiac output. And low cardiac output is heart failure. And this is only one type of heart failure with reduced ejection fraction. So low ejection fraction means heart failure with systolic dysfunction, and usually low means less than 40%. That's the HFrEF, heart failure with reduced ejection fraction. But if we have normal or preserved ejection fraction, a normal ejection fraction does not exclude heart failure, because a normal ejection fraction means what? Normal systolic function. But what about the diastolic? Can we have diastolic dysfunction with a normal or a preserved ejection fraction? Yes, sure. And this type of heart failure is heart failure with preserved ejection fraction. What caused this heart failure? It is the diastolic dysfunction and not the systolic dysfunction. Okay, so I'm gonna end this segment here, and we're gonna have more discussion about heart failure in the coming segments.